So we're going to tape an ankle. This is just sort of a very generic way to tape an ankle for the common athletes if they want to get back into sport or if someone's after for a bit of stability. So firstly with the fixed mole, we're going to be sort of operating along the sides of the ankle and around the heel, so we want to sort of cover that whole area. We do a few stirrups. Doesn't have to be tight at all. Might want to have a bin as well nearby. And I usually like to do one around the front here. Okay, so starting position is important to have the patient in not sort of plantar grade, otherwise you're going to tape them into too much dorsiflexion or too much plantar flexion. First one is just an anchor, doesn't have to be tight at all, it's just a starting point. And then next is stirrups. So I'm going to start on one side. I usually start medially, make sure there's a bit of tension on this, and then you just pull it across. And then when you finish, again, apply a bit of tension. And I usually do 3 stirrups. It's nice that Matt doesn't have bony ankles, so the tape is sticking on quite nicely. We'll start one on the lateral side as well. Good. With the stirrups as well, make sure that you sort of come under the heel. If you come too far into the arch, then you can manipulate their foot and pull them into too much dorsi. Okay. So that's stirrups. The next is sixes. So it's just as it's described, a figure 6. You start on one side, and then you come up across the ankle joint a little bit there, and then you do the same thing on the other side. And this is where fixed mole might come in handy, because often athletes or patients might complain of rubbing in this area. And we usually do 2 sixes on each side. Now at this point, I normally ask the patient how they feel. If this is pretty stable for them, that's good. If they still feel a bit unstable, then we can go into a heel lock. And what that is, this can be a bit confusing, but you start from the middle and you have to end on the same side. So then you go around the Achilles, underneath the heel, and finish up on that same side there. Okay, and then you do the same thing on the other side. Start from the middle, around the Achilles, under the heel, and the tape should just follow you really easily. Okay, like that. And usually we would do 2 heel locks as well on each side. And then to finish up, just lock it all off, because you start at the top. That's your ankle.
Another option for the heel locks is to have the tape down a little bit further over the foot. So we would start down, just down from the ankle, come down under the heel, lock that in, and then come back up around and finish up in a similar place. And then do the same in the opposite direction, around the outside of the foot, underneath the heel, And back around, lock that in, and finish up in the same spot.